Injuries to the foot and ankle. Chondral lesions to the talus and tibia. These are focal injuries to the talus with variable involvement of the subchondral bone and cartilage, which may be caused by a traumatic event or repetitive trauma, meaning that in the picture here, the little tears you see here and here, those are small lesions or tears in the talus for this case, or it can also have in the tibia, caused by repetitive forces in the area. And most commonly, it can develop in two ways. It can be by ankle eversion dorsiflexion during external when you're putting forces on the ground, cause a lateral tear, or with a combination of ankle inversion, external rotation, and plantar flexion during external, again, when you're putting forces into the ground and cause a medial tear. Most symptoms can include in signs pain or center over the joint line here, joint effusion, or catching or locking, meaning either your ankle may catch into another part of your, it's probably your tibia or your foot, or your ankle is not moving at all. Some special tests include palpations. So when palpating your patient's foot or ankle or tibia, if they find any pain when you touch, it could be a sign that it could be a chondral lesion. So there are two ways to treat this. Either you can go through surgery, or for less severe cases, you can cast it or wear a boot, or do physical activity or therapy. Next, we have posterior tibial tendinitis and penile tendinosis. These two injuries are kind of similar, but also vary in what is affected. For penile tendinosis, it's inflammation in the tendons that run along your outer ankle and to the lateral side of the foot. So as this image states here, on the lateral side of the foot, the tendon here is inflamed. While posterior tibial tendinitis is inflammation of your posterior tibial tendon. And so as you can see right here, the tibial tendon, posterior tibial tendon right here, that area will be inflamed. And both of them can be caused by a result of overuse, or it can be a side effect of an ongoing ankle injury. Most signs and symptoms include swelling, redness, or warmth in the tendon. For penile tendinosis, you usually see a more thickened tendon with a mass or a nodule that moves when you move around. And both for both, a patient can feel weakness when pushing off on their foot or ankle. To continue, some special tests vary depending on which condition you have. For penile tendinosis, you can palpate, do resisted eversion or dorsiflexion, or do a penile sublation test, which the examiner feels the penile tendons behind the large malleolus, and then with your patient being in active dorsiflexion and eversion, the clinician checks if the tendon pops out or moves abnormally from its normal position. While for posterior tibial tendinitis, you can either do manual muscle tests, palpations, or a single limb heel rise, which the patient stands on the top of one foot and tends to rise on their toes. And for that case, if their positive test will be any pain or uncomfortableness. And the same thing for penile solution tests. When the nodule pops out of, if it doesn't pop out in the correct position, or is there any pain with it, it's a chance that there is a penile tendinosis. And it's going back to posterior tibial tendinitis. If there's any pain when rising on their toes, it could be a sign of a case of posterior tibial tendinitis. Some treatments or immediate care could be physical therapy or rehab, wearing a brace or cast, or in worst cases, surgery. Medial tibial stress syndrome, or more commonly known as shin splints, is an injury is a extrusion-induced pain over the anterior tibia and can commonly be caused by running, jumping exercises, or any exercises that cause a lot of weight bearing in the shin. So, by you look here, the little redness here and here, that's where you would commonly see the injury caused by shin splints. Signs and symptoms can include tenderness, soreness, and mouth swelling. Most special tests can be palpations, and for immediate care and some basic treatments could be calf and lower leg exercises, supporting insoles so when your weight bearing, all weight is evenly distributed instead of in one main area, and some manual stretching. Pes cavus foot, aka high arch foot. So based on the name, pes cavus is a condition where a person has a high arch foot and can be caused by sometimes it wasn't choose to or you can be born with it. So as you can see here, this is a normal arch foot. So you see the arch is slightly even, and here the foot is arches here and here. While in the high arch, you see a much bigger arch here, and the foot is more lifted. So signs and symptoms can be pain within the ball or heel of the foot, ankle swelling or pain, arch pain, and with some cases, if the arch is still present, it can lead to clawed toes, where the toe is clawed up like a claw of my hand. Special tests can be a Fieseline test or the Pullman block, and some immediate care treatments could be having more shoe inserts to even distribute your foot and make the arch of the foot go down, or wear a brace, splint, or a cast also to lower the arch. Plantar fasciitis. This is inflammation in the plantar fascia. So right here is the plantar fascia, and around here where the heel is at is the plantar fasciitis, which is the inflammation of the plantar fascia and caused by repeated overuse, stretching, or tension of the bottom of the feet, causing it to irritate or inflame. Signs and symptoms could be a stabbing type pain when your heel strikes the ground. Special test is the Lewis test to see if there's arches when you're sitting down or standing up. And also for immediate care, some basic gym protocols is to have better shoes or change the insole or your shoes to support your plantar fasciitis. Gastrocnemius and soleus strain. As the name states, this is a strain of the gastroc and soleus muscles, but in this case, what a strain is when the muscles are stretched to beyond their limits, causing tiny tears of the muscle fibers, and can also be caused by overuse, stretching, or jumping, running, or cycling. So as you can see here in the gastroc strain, we have a normal healthy one here where there's no strain and stuff, but if you look here in the strain, all these little red dots are tiny tears in the muscle from the overuse. And same here for the soleus one, you can see all those tiny red tears in the muscle. Signs and symptoms include sudden pain, which for them can be a sharp tear pain, like tearing a piece of paper or tearing a piece of skin off your skin, swelling and bruising, tenderness, difficulty walking or standing, or your muscle feels stiff. Special tests include the Thompson test, especially with the gastroc, to see if there's a strained gastroc. Maybe there could be a issue with your Achilles tendon, but we have to be aware of if there is a gastroc strain, then the Thompson test may be a little bit painful or uncomfortable for the patient. And then some immediate care and basic protocols would be compression, cryotherapy, elevation, stretching, and surgery in more rare cases where you have to repair the muscle. ankle dislocations. So this occurs when there's a narrow separation between the bones of the ankle joint, so the talus, fibula, and tibia, and can cause by a persistent injury of the ankle, which more and more ankle ligaments tear within the bones separate. So you see here the ligaments connecting the fibula and talus are disconnected, causing the ankle to separate here, causing it to dislocate. As you can see here, the little bruising here, and you see the little caved in of the ankle here, can show sign of dislocation. The signs and symptoms are immediate severe pain, swelling and bruising, sore to touch, inability to weight bear, deformed look to the ankle, which you see right here, where it's a little bruised and it looks a little caved in here and here. In severe cases, a bone may poke out, so that's not as common, but it still can happen. In that case, we can go to specialty tests where the anterior drawer, Taylor tilt, squeeze test, and Kleiger's test can all see if any of the fibula, tibia, or talus is any way affected or any way infected. And in most cases, surgery is needed to repair and put back the ankle in the correct spot, as well as after surgery, boot and cast is needed, and to also avoid elevate the ankle to relieve any pain. And that's it.